Hello my dear friends, now we are actually going to begin with the most important topic in heart, that is about the blood supply of the heart, guys. So we are going to learn basically the coronary circulation. Now in coronary circulation, first of all I am going to teach you about the coronary arteries. I think you are able to see the diagram on the screen there. Now in this diagram it looks like a very complicated, guys. So we'll do one thing here. First of all, let us draw our own schematic diagrams, and then at last I'll make you even draw this diagram also. We'll compare with our diagram with this diagram also. Now how we are going to plan this topic, first of all I'll teach you the origin of the coronary arteries, from where are they beginning, and then I'm going to teach their course, how they are traveling, and then number 3 I'm going to teach their branches, and finally the most important and the most complicated part to understand, that is the supply. And don't worry, I'll make it easy for you guys, like which coronary artery will be supplying to which part of the heart. We are going to study that one. Is it okay? So that is the thing: origin, the course, branches and the blood supply. So let's get started with the coronary circulation, guys. So we are going to study about the blood supply to the heart, coronary circulation. Now everyone knows that the name of the artery which will be supplying the blood to your heart will be your coronary arteries. And coronary arteries will be actually two in number. One will be the right coronary artery and another one will be the left coronary artery, guys. So let's start again from the scratch. Heart will be supplied by coronary arteries. There will be two of them, right and left. First, let me teach you the origin of these two coronary arteries. From where are they going to begin? The origin. You got to remember that both the coronary arteries are going to begin from aortic sinuses. This is the golden word that you have to remember always, guys. So coronary arteries are going to begin from where? They are going to begin from aortic sinuses. Now these aortic sinuses, there will be one anterior aortic sinus, but remember there will be like two posterior aortic sinuses. Okay, so there will be one anterior aortic sinus and then there will be two posterior aortic sinus. So because there are two posterior, those two posterior aortic sinuses are divided into, one will be the right posterior, another one will be the left posterior aortic sinus. And you all know very well how to read my tables. Read it from below completely. So one is your anterior aortic sinus. Read the name completely, guys. Try to learn it like this: anterior aortic sinus. And then there will be a right posterior aortic sinus, and then there will be left posterior aortic sinus. Okay. Now from the anterior aortic sinus begins or originates your right coronary artery. That is the right coronary artery beginning from anterior aortic sinus. And then the left posterior aortic sinus, that is the one from where begins the left coronary artery. Left posterior aortic sinus, from there begins the left coronary artery. And remember, nothing will be coming from the right posterior aortic sinus. It is actually a non-coronary sinus. Non-coronary sinus, guys. So most importantly, focus on the origin of the right coronary artery and left coronary artery. Now some of the students will be like, sir, we have written the table, we have understood everything here in the notes, but the problem is, where do you have this aortic sinuses exactly? Exactly where do you find this? So remember, aortic sinuses will be present exactly at the very beginning of the ascending aorta. So we all know very well, ascending aorta will be beginning from the left ventricle. Out of the four chambers of the heart, from the left ventricle ascending aorta begins. And just imagine in your mind the very beginning of the aorta, ascending aorta. So you just imagine my hand here. This is the very beginning of the ascending aorta here, sir. Understanding? So right in the front there will be one anterior aortic sinus, okay, from where right coronary artery begins. And just behind that you will be having like two posterior aortic sinuses. There will be right posterior and there will be left posterior, and from the left posterior begins your left coronary artery, guys. Okay. So after writing these notes, you should even understand where exactly you have this aortic sinuses. Okay. Better we'll do one thing. We'll draw a small diagram for this one, a small schematic diagram. So imagine again the same thing, guys. This is our heart here, the simplest diagram of the heart. And heart is actually divided into four chambers here. And out of these four chambers, imagine this one to be your left ventricle here. And from the left ventricle begins your aorta, ascending aorta. And right in front of the ascending aorta, there will be one sinus here, and that is your anterior aortic sinus. And this will actually give rise to the right coronary artery. So better you write down once more here. right coronary artery begins from anterior aortic sinus. Right coronary artery begins from where, sir? Anterior aortic sinus. And then similarly, just behind that, you will be again having like two sinuses here. One will be the right posterior, another one is the left posterior. And from the left posterior, guys, from the left posterior aortic sinus begins your left coronary artery. So, left coronary artery begins from left posterior, that is important, left posterior aortic sinus. Perfect. Once for the last and final time, guys, we are done with the origin. So, right coronary artery begins from anterior aortic sinus, whereas the left coronary artery begins from left posterior aortic sinus. Now, after learning the origin, let us learn the course, how they are traveling, and finally, what are the branches given by both the coronary arteries, guys. Okay. So, please write down the heading there. We are now going to learn about the course and branches of both the coronary arteries. And again the same thing as usual, when it comes to notes, guys, I am telling you, don't try to write down the notes like paragraph. I really hate that one. Why? Because during the regular classes, students will be writing the notes like a paragraph, but at the end, just before the exam, you have to revise all the subjects. And it should be done in an easier manner. So if you write like paragraph, you will not be able to read that entire thing again at just before the exams and all. So better way, write down the notes in my style here, sir. In anatomy, it's all about conceptual and image based anatomy, sir. So I'm going to teach you with the images, and there itself you can just write down the notes. It makes it easier for you to revise before the exam. Okay. So we'll do one thing for the course and the branches. Let's draw a diagram here, which is like exactly present in your books. Now imagine this one is to be your heart here. Our heart is like a fallen cone, as I said you in our last video. Now somewhere here will begin your ascending aorta, and at the very beginning of the ascending aorta, you will be able to find the three aortic sinuses. There will be anterior and then there will be two posterior. Now from the anterior aortic sinus begins your right coronary artery, and right coronary artery will go in this manner, then take a turn, and it is going posteriorly. So this will be the right coronary artery. So it's very simple, it's just going around, okay. So it's just taking a turn and going back posteriorly. And after going back, remember the right coronary artery will give a branch here, and that branch is very much important. Now let's try to make the name. Do one thing, already in our previous video, I told you about the position of the heart, and you all know very well, here you will be having your ventricle. There will be a right ventricle and the left ventricle. Now that artery, I can clearly imagine that artery is actually going between the two ventricles, the right ventricle and the left ventricle. What is the name? Interventricular artery. Interventricular artery. Now is it like anteriorly present or posteriorly present? Obviously, guys, you can clearly see in my diagram here, it is a posterior interventricular artery, guys. Okay. So the first point that you are going to remember here, right coronary artery will give a branch here, which is posterior interventricular artery. Point number one. Not only that, while the right coronary artery is taking a turn, it is giving a branch along this margin here. That's the reason why it is known as right marginal artery. So along this margin, it will be right marginal artery, guys. So let us simultaneously write down the notes also. So right marginal artery is a branch of which one, guys? Right marginal artery is a branch of right coronary artery. And the same right marginal artery, it is also known as acute artery. Another name of this one, it is also known as the acute artery, guys. Done. That's all. That's all. Now on the other hand, let us see about the left coronary artery now. Left coronary artery, as I already told you, it is going to originate from where? It is going to begin from the left posterior aortic sinus. But one thing important that you have to note down here, that left coronary artery is very much shorter in length. It's not like very long, it's very much shorter in length, and then immediately it is going to divide into two branches. Which two branches? There will be one branch which is going to take a turn and then again go back. And I hope all of you know that in anatomy, whenever any artery is going to take a turn, the name of that artery will be actually circumflex artery, guys. Wow. So circumflex artery is actually a branch of left coronary artery. Now similarly, the left coronary artery will give like one more branch which will be coming down here. And again you can appreciate in the diagram there, yes sir, it is the branch present between the two ventricles, the right ventricle and the left ventricle. That is why it is interventricular artery. And this time you can clearly see in my diagram, it is present in the front. So therefore this one will be the anterior interventricular artery. Anterior interventricular artery, guys. So let us write down here simultaneously. Left coronary artery. Number one, remember it is giving a branch, that is circumflex artery. And another one will be the anterior interventricular artery. AIVA, anterior interventricular artery. Now that same anterior interventricular artery, remember it is also known as LAD artery. Now what is this LAD artery, sir? Left anterior descending artery. And you got to remember this name here because it is most commonly used in your pathology, internal medicine, even after completing your course here, when you go for practice, that LAD artery, that is the term which is used, sir. And it is very easy to remember why the name is given like this. It's a branch of left coronary artery, left, present anteriorly, anterior, and it is coming down, descending down. Left anterior descending artery, LAD artery. Another name of anterior interventricular artery, guys. Now apart from this, what else do you have to learn here is, yes, circumflex artery while taking a turn, it is going to give rise to a branch here along this margin here. Obviously, what should be the name? The name of this branch will be the left marginal artery. It will be left marginal artery. So as we have right marginal, similarly we will be having the left marginal artery. But be very, very careful there. Left marginal artery is a branch of circumflex artery. It is not the branch of left coronary artery, it is a branch of circumflex artery, guys. And this left marginal artery, it is also known as the obtuse artery. Obtuse artery. Done. So in this manner, if you just practice this diagram here, you will be done. You will be easily able to remember without getting confused with just mugging up and getting confused. You can easily remember all these branches given by a right coronary artery as well as left coronary artery. Now I will tell you what was the question which was recently asked in one of the exams. Okay, there is one more branch or one more artery which is known as the diagonal branch or diagonal artery, guys. Now diagonal artery is a branch of which one? So in this diagram, remember AIVA, that is nothing but your left anterior descending artery, LAD artery. LAD artery is the one which will give rise to a diagonal branch here. Don't worry, I'll show you that in the diagram also. So this one, you imagine this one to be the diagonal branch. So in my diagram, you can clearly see the diagonal branch is branch of AIVA. But in the exam, the question was, it will be supplying to which chamber of the heart? Now here, you can obviously apply a little bit of common sense. Which chamber do you have on that side? That's the reason why we have done the previous video in which I showed you the entire location of the heart first of all. So diagonal branch is the one which will be supplying to left ventricle. The chamber over there is left ventricle, and that was the question asked in the exam, guys. Okay, done. So according to our planning, we are done with the origin of the coronary arteries, and not only the origin of the coronary arteries, we are done with the course and their branches. And after completing this, welcome to the most difficult thing for most of the students, that is blood supply. Which coronary artery will be supplying to which part of the heart? So let's learn the blood supply. And I promise you all, guys, I am going to make it damn easy for you people. Now the best way to learn the blood supply, let us draw our own diagram, like a schematic diagram here. So look here. So for example, again the same thing, this is the simplest diagram of the heart possible, divided into 4 chambers, the 2 atria and the 2 ventricles. Now in this diagram, what I am trying to do, I will remove the atria from the above. I am going to remove the atria from above, and we are going to draw only and only the ventricles, guys. Okay. So start drawing the diagram with me. So imagine this one to be your ventricles here. We have removed the atria from above, sir. Okay, these are the only ventricles here. And in between the ventricles, you will be able to find the interventricular septum here. This will be the interventricular septum. So basically this is your right ventricle over here and this one will be the left ventricle here. Okay. So instead of getting confused with difficult diagrams and difficult the paragraph, I'll tell you in another 4-5 minutes this is going to become like easy for you. Okay. So after drawing this diagram, do one thing, mark a line here, sir. Mark one imaginary line here. Now each and everything present on this side of the line here, this side of this green colored line, that imaginary line, each and everything present on this side will be supplied by a right coronary artery, and each and everything present on this side of the line will be supplied by the left coronary artery, guys. So that's an important thing. That's our planning here, guys. So each and everything present on the right side of the green line supplied by right coronary artery, and everything on the left side is supplied by left coronary artery. Now out of these two, first of all, let's deal with the right coronary artery, sir. Let's see, right coronary artery will be supplying to which parts of the heart. First of all, right coronary artery will be supplying to the chamber present above. Above you'll be having right atrium, and the chamber present below. Below you'll be having the right ventricle. Now you might be like, sir, what is difficult in this one? It's a right coronary artery supplying to the right atrium and right ventricle. It's so easy. Now starts the real story. Now starts the real confusion, guys. Not only the right atrium and right ventricle, observe the diagram more closely. Are you able to see this part here? Yes, that part belongs to right ventricle or left ventricle? Left ventricle. So therefore, my dear friends, remember, right coronary artery is supplying to the posterior part, a small posterior part of left ventricle. Being a right coronary artery, it is also supplying to a part of left ventricle. And not only this, yes, are you able to see this part here, sir? I told you everything on the right side of the green line. Are you able to see that part? Yes. And that is the posterior part of interventricular septum. So right coronary artery is the one which will be supplying to posterior part of interventricular septum, guys. It makes sense now. Understanding? Now similarly, apply the same thing on the other side. Now let us learn about the blood supply by left coronary artery. Now apply in the same manner, guys. Left coronary artery will be supplying to the chamber present above left atrium, and just below that it will be also supplying to the left ventricle. So left coronary artery will be supplying to the left atrium and left ventricle. Easy. Now observe the diagram more closely, guys. It is also supplying to this part here. That is nothing but the anterior part of anterior part of right ventricle. Oh my God, look at the confusion there. Being a left coronary artery, it is also supplying to a part of right ventricle. And not only that, it is also supplying to this part here, sir. That is the anterior part of interventricular septum. I hope now you will 110% agree with me. The best way to learn is with the diagram given in the center there, guys. So in your textbooks and all, they'll be just giving you all these things in a theoretical manner. Right atrium, right ventricle, left ventricle, anterior part, posterior part. So instead of getting confused, best way, practice the diagram given in the middle there, guys. It will become easy for you. Now hold on. Now don't think that the topic is done. It is not yet done. After completing all these chambers, we are even left out with one more thing. Conduction system of the heart. Inside the heart, you also have conduction system, all that SA node, AV node and all, who will be supplying the blood to that one. Okay, so let us make that one easier right now, sir. So write down there, conduction system of the heart. In conduction system of the heart, it will consist of SA node, and then there will be AV node, and then bundle of His, right bundle branch and Purkinje fiber, left bundle branch and Purkinje fiber here, sir. So I'm going to make it easy with the help of our easy diagram here, sir. So this is the conduction system of the heart without the heart. We have removed from the heart, sir. So SA node, this is AV node, and this here will be the bundle of His, and then you have got the right bundle branch, and this is the left bundle branch, and your favorite Purkinje fibers here. Perfect. So that's your conduction system. Now after drawing this diagram, follow my method. Just highlight this one, sir. SA node, AV node, bundle of His, and a small part of left bundle branch. I repeat again, SA node, and then AV node, and then bundle of His, and then the minor part, a small minor part of the left bundle branch. And all this will be taken care by right coronary artery. Easy. And then whatever is left out here, that is all taken care by your left coronary artery, guys. Perfectly done. So now after drawing the diagram, let us do one thing here. Let's write on the notes. So right coronary artery will be supplying to which parts of the conduction system of the heart? It will be supplying to SA node, and then AV node, and then bundle of His, and here starts the confusion, left bundle branch. Being a right coronary artery, it will be supplying to left bundle branch, but not entirely, sir, only the minor part of that one. Now on the other hand, left coronary artery, it will supply to left bundle branch. Of course, the major part of that one which is left out. But confusion is right branch. The entire right bundle branch will be taken care by left coronary artery, and that has been already asked in the exam, guys. Be very careful. And now I think for my students, whoever is listening to me right now, you don't have any problem at all. Just with the help of this simple diagram, I am sure this diagram will somehow stick in your mind, guys. If they ask you in the exam, you can easily answer this one. Okay. So that completes about the conduction system of the heart, sir. Now in this, one more important variation that I want to tell you is SA node, sir. Sinoatrial node here, SA node. SA node is actually supplied by nodal branch. Easy to remember. The artery which will be supplying to SA node, nodal branch, no confusion at all, easy to remember. And I said you that SA node is supplied by which coronary artery, sir? Right coronary artery. So basically, right coronary artery will give the nodal branch that will supply to SA node. But remember, it will happen only and only in 65% of the population. In 65% of the population, right coronary artery is giving the nodal branch. Whereas in the remaining 35% of the population, okay, left coronary artery will give the nodal branch, and that is actually going to supply to your SA node. So you have to remember this variation here, guys, regarding SA node. I repeat again. First of all, I told you here in our diagram that SA node is supplied by right coronary artery, and now we are going in little bit more depth. Remember, in 65% of the population, it is supplied by right coronary artery, but in 35% of the population, SA node will be supplied by left coronary artery. Hope the things are very clear, guys. That is about the supply. Fine. Now after completing all this, I hope the coronary circulation will be a little bit easier for you guys. Now we'll do one thing here. In this entire thing, I have actually drawn like our own simple diagrams. Now let us compare this with the diagram which is actually given in your textbooks here, guys. Let's have a comparison here. Now in this diagram, you are able to appreciate, first of all, this is your ascending aorta here. An ascending aorta, right at the very beginning of the ascending aorta, you will be having a sinus, anterior aortic sinus, and from there you can appreciate here right coronary artery. It takes a turn and then it is going behind. And there the right coronary artery will give a branch, and this branch will be your PIVA, that is posterior interventricular artery. It's present behind. And in this turning part here, you are able to see this is nothing but the right marginal artery. Are you all understanding, guys, my method? Now why I am doing it like this here? Why? Because if I show you this diagram initially, in the very beginning itself, you will go mad. All sorts of arteries and confusion, guys. The best way, after completing the entire topic, let's compare this with this diagram here. And the right coronary artery will also give a branch, if you are able to see here. It is the nodal branch, guys. It's actually going behind the superior vena cava. Keep that point in mind. So right coronary artery will give a nodal branch, and that will actually go to the SA node, which is found obviously in which chamber of the heart? Right atrium. And then I told you the left coronary artery is very much shorter here, sir. It will be immediately dividing into two branches. One will be the circumflex artery, and another one will be the anterior interventricular artery here, AIVA, which is also known as left anterior descending artery. And that is also giving a branch here, and this branch is the one which has been recently asked in the exam, the diagonal branch. This is the diagonal branch, and you can clearly see in our diagram it is going and supplying to which chamber of the heart? The left ventricle, sir. So diagonal branch is going and supplying to left ventricle, guys. That's the comparison between like our diagram and the diagram which is given in the textbook here. Done. Now once you're perfect with all this, I want to deal with one more concept here itself, guys. Let us discuss about one more small concept here, that is about cardiac dominance. Cardiac dominance. This has been asked like many times in your exam. Now just now I told you about posterior interventricular artery. Recall in your minds, posterior interventricular artery is a branch of, yes sir, it's a branch of right coronary artery. Okay, so in most of the people, posterior interventricular artery is a branch given by right coronary artery, and these people are said to be having right cardiac dominance. Okay, these people have got right cardiac dominance. But in some people, what will happen, the circumflex artery which is going behind will give rise to PIVA. Just now I have shown you in the diagram, the circumflex artery which will be going behind will give rise to PIVA. And obviously it will be said to be the left cardiac dominance. That is left cardiac dominance. So if the right coronary artery will go back and give PIVA, right cardiac dominance. If circumflex artery is going back and giving the PIVA, then it is left cardiac dominance. And in few people, what is going to happen, like both of them will contribute for the formation of PIVA. Both right coronary artery as well as the circumflex will contribute, and that third category, the third type, is said to be the combined cardiac dominance. Combined cardiac dominance. And one more name, we can even call it as codominance also. So combined cardiac dominance or codominance, wherein both right coronary artery as well as circumflex will contribute for the formation of PIVA. Now that's a simple concept, okay? Three types of cardiac dominance. Now what are the questions which are possible here? Out of these three types of cardiac dominance, which is like most common cardiac dominance, remember in 90% of the people it is right cardiac dominance. So that is the most common one. In hardly like a 9 to 10% of the people, 9% of the people, it will be left cardiac dominance. And the very rare one will be the combined cardiac dominance, hardly in 1% of the population. Okay. So 90% it is actually the right cardiac dominance, the most common one, and then 9% left cardiac dominance. And in 1% of the people, it will be combined cardiac dominance. Now one thing I'll tell you here, most of the students are confused with, what they are trying to understand here is, dominance more, they are like directly translating. They are thinking that dominance more and more blood supply, and they are thinking that right coronary artery will be supplying more blood to the heart. See, during my lecture here, I have never used that about the more blood supply and all. It's all about that branch. So who is the hero of the story here? The hero of the story here is PIVA. It's only about this branch, guys. I have never said you more amount of blood supply and all. So whichever artery gives the branch, that cardiac dominance. Understanding? Right coronary artery gives PIVA, right cardiac dominance. Circumflex will give PIVA, left cardiac dominance. Understanding? It's all about that branch. That's the hero of the story. Posterior interventricular artery. It has nothing to do with the blood supply. And if you want to learn that one also, if you are interested, remember our heart is mainly supplied by left coronary artery. Understanding? The left coronary artery is supplying more blood to your heart, not the right one. So don't get confused between this dominance and the amount of blood. That is what I am trying to put in your mind. Understanding? So that is about the cardiac dominance. And that completes everything related to the blood supply to your heart in detail has been completed, guys. Welcome back, my dear friends. Now after completing the arterial supply of the heart, now let us go towards the venous drainage of the heart right now, sir. Now in the venous drainage of the heart, first of all let me explain you on this diagram, then we'll draw this diagram here guys. Okay. Now in the venous drainage of the heart, the hero of the story, the main thing here will be the coronary sinus here. Will be the coronary sinus here guys. Now here I have seen a lot of students getting confused between aortic sinus and coronary sinus. So recall in our previous topic arterial supply there was aortic sinus, but now venous drainage we are having the coronary sinus here guys. Now just observe carefully where is this coronary sinus located. Location is very much important here sir. This coronary sinus I can clearly see the chambers above will be nothing but your atria here, and the chambers below this will be nothing but your ventricles here. So between the atria and the ventricle there will be a groove. So it is present in the atrioventricular groove. First learn the location of this one. So coronary sinus is located in the groove between the atria above and the ventricle below. So atrioventricular groove. Look at the diagram carefully and tell me, or look at the diagram carefully and understand there guys, is it like anterior or the posterior? Coronary sinus is present anteriorly or posteriorly? Remember, in the diagram we can see that the coronary sinus is present posteriorly. So what is the complete exact location of the coronary sinus? It is in the posterior atrioventricular groove. Posterior atrioventricular groove. Now once you have understood about the location of the coronary sinus guys, now the concept is so easy, this topic is like very much easier. Like almost all the cardiac veins are going to drain into coronary sinus. There is an exception, I will tell you about that one later on. But remember, almost all the cardiac veins will drain into coronary sinus. Let me prove you that. So if this is the coronary sinus over here, now you can clearly see here, this will be the great cardiac vein guys. There will be a vein, great cardiac vein, and just follow the great cardiac vein. Yes, it's going back, taking a turn, and then it will go and drain the blood into coronary sinus. So great cardiac vein will drain the blood into coronary sinus. On the other side, you'll be having the small cardiac vein here. There will be a small cardiac vein, and again the same story here. It is also taking a turn, going back and draining into the coronary sinus. And one more thing that you have to appreciate in the diagram here, the middle cardiac vein. The middle cardiac vein will also drain the blood into the coronary sinus here. So great cardiac vein, the small cardiac vein and the middle cardiac vein, almost all the cardiac veins will drain the blood into coronary sinus. Now after the blood is collected in coronary sinus, from here it will be going to drain the blood into which chamber of the heart? Of course, inside the right atrium. Sir. We all know all the impure blood, deoxygenated blood which is collected will be draining into which chamber of the heart? Right atrium. So from today onwards you remember like this guys, from upper half of the body blood is collected by superior vena cava into the right atrium. From the lower half of the body blood is collected by inferior vena cava into which chamber of the heart? Right atrium. Now what is left out? Upper half is done, lower half is done. We are left out with the heart itself. From the heart, blood is collected by coronary sinus and that will also drain into which chamber of the heart only? Right atrium. Now why I am stressing a lot on this point here, already that has been asked in your exams. Understanding? So coronary sinus will drain the blood into the right atrium of the heart. So fine. Let us write down all these points till here. Then we'll go ahead with the further things, sir. So write down the heading there. We are now learning about venous drainage of heart. In the venous drainage of the heart, the first thing that you have to learn here is coronary sinus. Now in coronary sinus, I want you all to remember the location of coronary sinus. So where is coronary sinus located, sir? It is located in the posterior atrioventricular groove. Posterior atrioventricular groove, guys. Okay. And I want you all to remember like one more name for this one. It is also known as coronary sulcus. So it is posterior coronary sulcus. So you can call it as posterior atrioventricular groove or posterior coronary sulcus. Then next you have to even remember about the length of the coronary sinus. Remember it is 3 centimeters long. Coronary sinus is 3 centimeters long. Done. That is about the coronary sinus. Then the second point I want all of you to remember is almost all your cardiac veins will drain the blood into coronary sinus, And from the coronary sinus, the blood will be drained into which chamber of the heart? Into the right atrium. So almost all the cardiac veins will drain the blood into coronary sinus, and from the coronary sinus, blood will be drained into right atrium. Now, which cardiac veins you have to remember for your exams? Remember, number 1, there will be a great cardiac vein. Number 2, there will be a small cardiac vein. And number 3, there will be a middle cardiac vein. At least these you have to know for your exams, guys. So all your cardiac veins drains into coronary sinus, and from there the blood will drain into which chamber of the heart? Right atrium. And now I want you to understand one important exception here, guys. I don't know whether you have observed this in the diagram or not. Great cardiac, small cardiac, middle cardiac, all of them are draining into coronary sinus. Well and good, fine. But if you are observing properly here, are you able to appreciate this vein here, sir? There will be 3 or 4 veins which are going to directly drain the blood into the right atrium of the heart, sir. So there are like 3-4 veins which are directly going to drain the blood into right atrium. They are not going to drain the blood into coronary sinus. And these are nothing but your anterior cardiac veins. And a lot of time this question has been asked in the exam. It's an exception. So it's a very simple topic. You can just remember this topic in one sentence. All your cardiac veins will drain into coronary sinus except the anterior cardiac veins. Anterior cardiac veins will directly drain the blood into the right atrium itself. Is it okay? So make a note of that in your books. So what is an exception here, sir? Number 3, there will be anterior cardiac veins. And remember, anterior cardiac veins will directly drain the blood into which chamber of the heart? Into the right atrium, guys. And there will be like 3 to 4 in number. There will be 3 to 4 anterior cardiac veins. That's all. You have to remember these points. Now, once you are done with all the points regarding venous drainage of the heart, as usual, let us draw the diagram. So this will be your heart here, sir. Our heart is like a fallen cone here. And imagine that this one here will be the coronary sinus. The hero of the story here. It is located in the posterior atrioventricular groove. Now this here will be the great cardiac vein, taking a turn and then draining the blood into the coronary sinus. The great cardiac vein. And similarly you have got like one more vein from here, taking a turn and then draining the blood into the coronary sinus. And this one here will be the small cardiac vein. And then finally there will be a middle cardiac vein here. Now just imagine that somewhere here you have got the right atrium. This is like just a schematic diagram, sir, for the sake of understanding. Right atrium. And there are like 3 to 4 veins which are going to drain the blood into the right atrium directly. And these are anterior cardiac veins. Anterior cardiac veins. Now apart from this, I want you all to like add 2 more veins over here. Number 1, there will be one vein which is directly coming from your left atrium, and this is actually known as the oblique vein. Oblique vein of left atrium, which is very famously also known as the Marshall's vein, guys. Marshall's vein. So the oblique vein of left atrium, which is also known as the Marshall's vein, will also be draining the blood into coronary sinus. And then there is one more vein from the left ventricle here, and this one will be the, I'm just writing here, guys, the posterior vein of left ventricle. The posterior vein of left ventricle, that is also draining the blood into coronary sinus. Fine. So this is about the venous drainage of the heart, guys. It's so simple. I'll tell you that statement again. Just one statement and the entire topic will become easy for you. All the cardiac veins will drain the blood into the coronary sinus except the anterior cardiac veins. Anterior cardiac veins are directly going to drain the blood into the right atrium of the heart. That is all about the venous drainage of the heart. And at the end of this video, you can compare the diagram. You can easily compare like our diagram with the textbook color diagram. Thank you. That's all.